Thank you. The problem is acute respiratory distress syndrome, which is a life-threatening inflammation and swelling of the lung. It makes it hard to breathe, you drop your oxygen, and you go on a ventilator with a very high mortality and higher in COVID. It's an orphan disease that affects greater than 10% of all ICU patients, and there is currently no therapy for ARDS. So the solution, ThyrOxy. 20 years of University of Minnesota ARDS research and drug development of a special thyroid hormone formulation to treat all causes of ARDS. We've done clinical toxicology, efficacy trial, and now phase 2 is enrolling. All of our patients extremely ill, but they've survived and thrived without side effect. So ThyrOxy may be the first medical therapy for ARDS. So why now? ARDS is ready for, or ThyrOxy is ready for a partner. It treats all causes of ARDS, including infections, toxic inhalation, or chest trauma by putting the medication into the lung to inflammation and lung swelling. So why us? Because we're treating patients now and have for over a year. We are a team of doers. We have over 40 years of ARDS experience. We have over 700 undiluted research funds and experience in the 505(b)(2). We've also had some great promotions, an above the fold front page Star and Tribune highlighting our work, as well as journal articles, high impact showing our science. So why is it a business? Because we've been de-risking it. It has a broad patent portfolio, a 505(b)(2) pathway. There's no competing medical therapy. There are numerous other diseases that could use it. We can fully make ThyrOxy now at a low cost. It has orphan drug potential status and an early phase 2 end. So our ask is this: an executive team that knows the NDA process and knows big pharma for connecting on partnering, phase 3 funding and support, and a vision for pipeline development for products for other diseases. We need your vision. Thank you.
Thank you for your presentation. Judges, we have 1:45.
Yes, you say that there's no current medical therapy. Can you explain why that is and what some of the barriers to this have been?
Yeah, so ARDS is a very complicated disease. There have been lots of tries at medical therapy, such as stem cell transplant, etc. But what we have found is a natural hormone replacement for the lung using thyroid hormone that has seemed to be effective with very low risk and no side effects.
I believe you mentioned that it gets injected directly into the lungs. Is that a barrier for ARDS or any other indications that you're thinking about?
We are in the process of making it a nebulized form and an inhaler and a spray. And so it has that potential. For now, it's instilled directly down the endotracheal tube to patients on ventilators.
And how far along are you in the nebulized version formulation?
That has not been tested yet in animals. We have the formulation ready, but we're really focused right now on the phase 2 ARDS patients.
Thank you.
But that would be part of the pipeline development that we're asking.
If there's time for one last quick question. So prior to COVID, about how many cases per year?
There are about 183,000, something less than 200,000 in the US. It's listed as an orphan disease on the FDA website.